When she's not waking us up on SABC3's Espresso, fitness fanatic Liezel van der Westhuizen can usually be found training or toning.
After the Argus, I was cycling home. I thought we'd get an extra cycling ride in, about 500 meters from home. Slipped on some sand as I was going onto the cycle lane, hit my hip, no scrapes, no bruises, and fractured my pelvis. And I immediately knew something was wrong. Couldn't get up, couldn't stand. So I had to sit there on the side of the road until someone could come and fetch me and take me to the hospital.
Liezel spent 3 days in hospital before embarking on a 6-week rehabilitation program. Now very aware of her bone health, she recently went for a bone density scan to find out if her injury was the first sign of a much bigger problem. Making use of X-ray technology, the DEXA scan has become a very accurate way of measuring bone mineral density and is frequently used to diagnose osteoporosis. Cipla will make it better.
So the question is, does Liezel have osteoporosis? And I'll tell you why I ask. She's lean, not a lot of fat in that body, and fat tissue is an important production center for estrogen, which protects bone loss. She trains excessively and she's fair-skinned. Those are some risk factors for osteoporosis. So Liezel, were you aware of that?
I was never aware of that until my fall, and everyone said, maybe you should go and look and have a bone scan and see what's going on. Why did the bone break so easily?
Toby, thank you so much for joining us. I mean, you're an expert on the subject. Who gets osteoporosis these days?
Osteoporosis is mainly a disease of postmenopausal females, but it can also occur very often in men, but also in younger people like Liezel. We should remember that you fell off a bicycle, and so that's not regarded as a typical osteoporotic fracture, which is a fracture that you sustain when you fall from own body height.
So let's talk about some of those risk factors then. I mean, Liezel obviously doesn't have a whole lot of risk factors, but there are some other significant factors.
I would say that probably the most important factor is the history of a previous fragility fracture. And the second most important one would be age. The older you get, the higher the chance or the risk of osteoporosis. And then third would probably be your family. You cannot choose your genes.
No, you can't.
And so if your mother or your father has had a history of osteoporosis or a fragility fracture, that certainly increases your risk a lot.
Okay, so we've ascertained what the risk factors are. If we have those risk factors, the next step is to actually go for a DEXA scan, which is what Liezel did. How was your experience, Liezel?
Well, I was worried. I didn't know what to expect. I didn't know what we were going to go through. I'd never heard of a bone scan before, and
is it going to hurt?
Is it going to hurt? And what the result's going to be? And it was really just a non-invasive procedure and very, very quick as well.
So we're all wondering, does Liezel or does she not have osteoporosis? What's the story, Doc?
I'm glad to report, Liezel, that you have not got osteoporosis and that the strength of the bone as determined by the DEXA scan is actually absolutely appropriate for age.
Great. Okay, so osteoporosis simply means porous bone. Liezel doesn't have that, as the scan clearly shows. What about people that do have porous bone? What are the treatment options?
We do have some very good medicine available today. The oldest available medicine for females is estrogen hormone replacement therapy. For many years, that's all that we had, and it's still, especially in the younger early menopause, is probably the most important factor, and it can be safely administered if you just discuss it with your gynecologist. But then we also have other drugs that will inhibit the resorption of bone.
So let's talk about that scan, Toby, because the issue with osteoporosis is the first symptom. There are no symptoms. The first symptom is a fractured bone. How do we know we've got weak bones?
I think that's a very, very good point. That's why we call it the silent disease, because you wouldn't know before you actually fracture. So fortunately today we've got the DEXA bone scan, which is a very useful test of your risk for fracture. So who should go for a scan? And we basically say that it should never be a routine exercise, but it should be for someone at risk. So who then are at risk? I think for women, the first point to consider it would be at menopause. The rest would be for males and females after the age of 65. I think there should be a reason why you should not have a DEXA scan after that age. Or when you have other risk factors, as for instance rheumatoid arthritis, or if you've used chronic steroid therapy for chronic diseases for a period of longer than 3 months.
What about lifestyle issues? Now, Liezel, you don't smoke, you don't drink. I mean, do those tend towards osteoporosis too?
Certainly so, but other lifestyle factors are if you lead a very non-active life. Weight-bearing exercise will always stimulate new bone formation, and that's a vital part of the normal physiology of bone. Your skeleton is actually a living organ, and it has to renew itself. And it does that by the cells called the osteoclasts that actually eat holes in bone, but then you have the osteoblasts that fill it up with an equal amount of bone. So if you're normal, you will have a complete equilibrium between resorption and formation. In osteoporosis, unfortunately, there will be more holes dug in your bones than there are being filled.
Toby, Liezel, thank you so very much. So glad that you don't have osteoporosis. Isn't that great news?
Yes,
so more riding for you.
Yay.
And no more accidents, hopefully. It was just a traumatic fracture, that we know. But if you are at risk for osteoporosis, in fact, if you want to know if you're at risk, stay tuned, because after the break, we're going to give you a risk assessment tool to tell you just that.
Hello, doctor.